A substantial concern to us is the possibility that insulin itself might contribute to the development of cancer. Turns out, in fact, that cancer is more common in people who have diabetes, and there's a little bit of uncertainty about whether that's just two independent diseases coexisting or whether diabetes can cause cancer. For one thing, many of the risk factors that lead to diabetes lead to obesity, and obesity is a pretty well understood risk for certain kinds of cancers. The kinds of cancers you see in diabetes are an increase in breast cancer, an increase in pancreatic cancer, colorectal cancer, bladder cancer, endometrial cancer. Now, breast cancer and endometrial cancer are, of course, cancers that are increased in frequency if there are high estrogen levels in the body. And it turns out that if you have more body fat, you tend to have higher estrogen levels. A substantial concern to us is the possibility that insulin itself might contribute to the development of cancer, which is always something that I'm a little reluctant to say because people tend to have negative feelings about insulin therapy anyway, and I don't want to add to their anxieties. But it is true that insulin is a growth factor for many tissues. Many body tissues have receptors on their surface that make them chemically reactive to insulin, and there is some evidence that high insulin levels will promote the development of cancers or the growth of cancers. But even here, I think there's a bit of optimism, because if you can change your lifestyle and diet, improve your insulin sensitivity, you will drop your insulin levels, and that might lead to a reduced risk of cancer.